Hi, my name is Brooke Johnson, Nurse Administrator with CNS Occupational Medicine. Today we're going to be discussing DOT physicals and what you need to bring with you to be prepared and ready. If you are scheduled for a DOT physical here with us, there are a few things that you're going to need to bring with you to get started. The first thing is your driver's license and a change of address card if that's applicable. You also want to make sure you have your medical card with you. All of this will get you started for your physical. In addition, if you are being treated by a medical provider for any of the following conditions, you're going to want to make sure you bring along some documentation to help us make your experience faster and efficient so that you can leave with your medical card today. For any drivers who are taking prescription medications, please be sure to bring a list of all your medications as well as the provider's information so we can reference that. Drivers who have diabetes need to bring the following with them. We need a copy of your last lab work, which includes your fasting blood sugar and your hemoglobin A1C. Please make sure that these results are within the last 4 months. If you've been checking your blood sugars at home, please make sure to bring your journal along with you for the provider to review. Anybody who's taking insulin needs to stop and call me right away so that we can go over further instructions. Drivers who are being treated for high blood pressure need to bring in a note from their last visit with their provider. This note should be regarding your blood pressure and include some blood pressure readings from the office. If you've been taking your blood pressure at home, also make sure to bring in that list for the provider to review. Drivers who are required to wear glasses, contacts, or hearing devices need to make sure that they have those with them for the exam. You will be using them for your vision and your hearing exam. Drivers who are being treated for any heart-related conditions need to make sure that they have the proper documentation from their cardiologist. This may include some medical testing, medications that you're taking, and a clearance. If you have any questions, please make sure to give me a call, as there are certain forms that may be required from your cardiologist. Drivers with sleep apnea and who are using a CPAP machine need to make sure to bring in a listing of the last usage over the last 365 days. This can be obtained from your provider or the company that issued you your CPAP machine. Any drivers who are under any mental health treatment and are taking medications need to make sure to have a list of those medications ready for the provider to review. In some situations, we do require a form that will be given to your provider for clearance on those medications to make sure that you are safe to drive a commercial vehicle. Any drivers who have completed an SAP program need to make sure to bring any documentation to show that you've completed the program and are cleared for driving a vehicle. Here's what to expect for your exam. First, you will need to complete paperwork. All this will be done upon arrival. A urine sample will be collected that will check for blood, protein, and sugar in your urine. A nurse will see you and will take your height, weight, blood pressure, pulse, oxygen saturation, temperature, BMI, and a neck circumference. You will also perform your eye exam and your hearing exam. Next, you will see the medical provider for your physical and determination. If any additional information is needed, instructions will be given, and you'll be given 45 days to make sure that the information is brought into CNS or faxed by your provider. Thank you for choosing CNS for your physical needs. If you have any questions, please feel free to call me at 717-839-5466, and I'll be happy to help you.